Hello, I'm Dr. Bessie here at Affinity Dental in Chicago. Today we're going to talk about crowns, and then we'll dive into the process of actually having a crown. So let's talk about the preventative reasons you may need a crown. So oftentimes we'll recommend crowns, especially on back teeth, to prevent fracture. Sometimes you'll have a filling that's really large, it's starting to break down. Sometimes the filling is staining, it's leaking along margins, and the option of placing a new, larger filling just isn't reasonable. Crowns can oftentimes be more predictable, they can protect teeth, they can prevent fracture. So when there's a large filling, when there's a crack, when a tooth is breaking down, we will prep the tooth for a crown. The crown acts as a cap or a covering on the tooth that holds the central core of the tooth together, and that prevents the tooth from future fracture and future cavities. So crowns, as far as an aesthetic option, can be great for people who have old fillings that are breaking down, fillings that are large, that are stained, that are starting to leak. You might notice an area on a front tooth that looks a little different than it did a year ago. Crowns can be great options for people with large fillings on their front teeth. With crowns, you can choose, the color, the shade, the size, the brightness. These are all things that we can work together and with a lab come up with exactly what you're looking for so that you can have the best aesthetic result. These oftentimes work much better than larger fillings. The contours are better, the shape is better, the brightness is better. These are great reasons to do aesthetic crown work on your front teeth. So let's talk about same-day crowns. So one thing we have here at Affinity Dental is a CEREC machine. It's essentially a digital video scanner. So once we've prepped the tooth for the crown, we take a quick digital scan. It takes about 30 seconds. There's no more goop, there's no more 3 or 4 minute impression in your mouth. The digital scanner is actually more accurate, it's way quicker, and it's super easy. Once we have the scan of the tooth, you'll actually sit there and watch me design the crown. That takes maybe 2 or 3 minutes, and then the crown will actually mill out of a block of porcelain. Once the crown is milled, we'll try it in, maybe make a couple little adjustments, and then that crown goes and gets baked in our oven. When the crown's done baking, we cement the crown onto the tooth, and you leave with the crown the same day. There's no need to wear a temporary, there's no need to come back 2 or 3 weeks later after the lab has made the crown. You leave with that same crown, porcelain, designed and milled the same day. So the benefits of a same-day crown, once the crown's on there, it's porcelain crown, it's literally bonded right onto the tooth. It stays on there, you never have to worry about the crown coming off. The crown looks just like a tooth, it's porcelain, it has translucent properties. It shows just like a tooth, it's bright, it's white. We can actually pick the shade of the crown together before the crown's milled, so you have an input on the crown, and then it's nice because you leave that exact same day with your permanent crown. So let's talk about the result of the same-day crown. So at the end of the appointment, we'll actually bond on the porcelain crown. It takes about 30 seconds to create that long-lasting bond onto the tooth. At the end of the appointment, you'll leave with the new beautiful crown. You'll be numb maybe 30, 40 minutes after the appointment, but after that, you're good to go. You're good to eat with the crown. There's very minimal post-op, little sensitivity, but the crown's ready to go. So if you have any other questions about crowns, whether it's preventative, cosmetic, feel free to call us here at Affinity Dental in Chicago. We're happy to set up a consult with you to answer any questions you might have and find a solution that works for you.